cross now to the UK, where our Mehmet Solmaz joins us now live from London. Mehmet, we all know the importance of testing. That's what experts are saying. And we see this in countries like South Korea, how important it is. I'm wondering how the UK is looking, perhaps, to change its testing strategy.
Alican, the UK government have stepped up its efforts to do more tests, and it has been under criticism for not doing enough. Currently, the country runs around 5,000 to 6,000 tests a day, and the government wants to pull that number to 25,000 by the end of April. But and there are also another measures announced by the government that it has purchased 3.5 million kits. And those testing kits are going to be distributed to ordinary people through pharmacies and also some of the GPs around the country as well. However, I think we need to make specific that the current tests that are run in the UK hospitals are taking a lot of time. First of all, a swab is taken from a person, and which then goes to a lab, and the machines look into the swab and diagnose whether if the person is infected or not. And this is taking a lot of time. Even the health workers themselves are not being tested, majority of them. And once the UK government announced that these 3.5 million kits are safe for people to test themselves at homes, and the government then will release these, and they will be also available to purchase online. These tests will look into the antibodies of humans, and it will diagnose whether if the person was infected and had the disease and now recovered. In such cases, people will be able to return back to work.
Mehmet, tell me, how are Britons dealing with the lockdown now?
Well, people are respecting the calls in general, I could say. The traffic is only about 10% of what it was before the lockdown. And at the same time, people are voluntarily trying to help the NHS as well. More than 500,000 people, 504,000 people volunteered to help health workers in their efforts. And at the same time, the government is stepping up its efforts to establish 13 makeshift hospitals around the country, and these are large venues, and in these makeshift hospitals, thousands of people will be able to receive treatment.
All right, Mehmet Solmaz live for us in London. Thank you.